Well, hello everybody, and thank you for those that have joined us for the first time, and those of you that are joining us for yet another exciting hour or so together. And on this occasion, we've got another fantastic lineup of speakers that's going to be talking about creating and sustaining health in the community and the role that we all play. And I know this will be particularly close to many of the hearts of nurses and midwives all over the world, because I think the one thing that nurses and midwives most certainly understand is the importance about community care, community health, and building assets within the communities in which we work. So this afternoon we're going to hear from Lord Nigel Crisp, that will tell you a lot more about this agenda and is our co-chair for Nursing Now. We've got Caroline Daher, who's the coordinator of Urban Planning and Environment, Giselle Sabag, who's Global Cities Consultant for Bloomberg Associates, and Mark Sansom, Director of SALUS Global Knowledge Exchange. So I think without further ado now, we'll hand over to Nigel to remind us about what this is all about. Thank you, Nigel.
Thank you very much indeed, Lisa, and thank you to Nursing Now and to Nightingale Challenge for holding this challenge, this particular global challenge. And thank you everybody for joining us. And it is a really difficult time. I've been on one or two calls already today and talking to people about just how tough and weary people are actually at the moment, and anxious about the future. So let me first of all pay tribute to nurses in my country, but also around the world. But also congratulate everyone who's found the time to think about the future, because this is about the future, and it's about what we in England have tended to talk about, building back better. But it's also what I'm calling, quite a lot of the stuff about COVID is about winning a war. Well, actually, this is about winning the peace. This is about making sure that we actually secure a better future for us all. So my challenge, should you choose to accept it, is to send to the Nightingale Challenge your ideas about an innovative nurse-led initiative to empower communities to create and sustain health. So empowering communities and what you could do. Now, it could be something you're already doing, it could be something you plan to do, or maybe it's still just an idea at this stage, but we'd love to hear it and to talk about it. The background and the context is that I was chief executive of the NHS in England, the biggest health system in the world. And when I retired from that post a few years ago, I've spent a lot of time since working in Africa and in Southeast Asia. And frankly, I've learned a lot. Learning is two-way. People without the sort of resources we have in my country, but also without the baggage of history and the vested interests, sometimes can innovate better than we can. And actually, we've got stuff we can teach, they've got stuff we can learn. There's an old saying people may know, that everyone's got something to teach and everyone's got something to learn. And one of the things I learned in Africa particularly was the real importance of thinking about health and thinking about it in a different way. And I've just written a book which is called Health is Made at Home, Hospitals Are for Repairs. And it's a saying from an African friend of mine, Professor Amazwa, Francis Amazwa, who used to run the Ugandan health system. And it's a great saying. It's not just, though, about providing services in the community. It's about the notion that health can be made. And if you think about our health systems, they essentially deal with the repairs. Some of the biggest issues around for all of us, leaving COVID aside, are things like obesity and addictions and stress and other mental health issues and poverty, all of them causing health problems. And the reality is the health system can really only do the repairs. It can't really deal with the causes. And we all focus on the repairs, but we also recognize increasingly the impact that our social environment has on us. And I know that Carolyn is going to be talking more about the social determinants of health and how important they are for us. I'm in a way talking about the other side of this in talking about creating health and making health, because the health very often people talk about the social determinants in terms of the damage that is done to people by a bad environment. We need to be thinking about the health giving properties of a good environment. And both Carolyn and Giselle will, I know, be talking about that. I'm really looking forward to it. But it's this point about the importance of creating health. And it's important what government does, it's important what health systems do, but it's also important what each and every one of us does. What we do as teachers, as employers, as parents, as architects, as communities. All of us have a major role in supporting and creating health. Worth remembering the World Health Organization definition of health, which is health is about physical, mental, and social well-being. We concentrate on physical health. We are getting better at concentrating on mental health, but we don't really talk much at all about social well-being. And that's really important, because we just look at our own lives and think about how our relationships, of all sorts, with our friends, with our loved ones, with our community, with our employers and so on, how much they impact on health. And we really do need to think about that social dimension. And I think that COVID has brought that to the fore. And it's how society treats us, how we behave in society, that impacts on our health so much. And my definition of creating health creation, is creating the conditions for people to be healthy and helping them to be so. Last time on this, when we had the first one of these two webinars, I talked about the health creators, the people like the nurse who set up a dance club with a policeman to provide activity for young people in the area, running for 14 years now. The nurse working with unemployed men in an estate in Salford and helping develop and create the community. The woman who set up social business called the Sewing Room, bringing people together, lonely women mainly, to do sewing and create a business in that way. Another group of women who started growing vegetables in public areas and had a real impact on the health and well-being and happiness of a community. And we also heard from nurses doing all kinds of these things in the community that are all about creating health, creating the conditions for people to be healthy and helping them to be so. And there are many such examples in Africa, in India, in Latin America and elsewhere. And in my book, I talk about lots of them. But there are, and there are examples not just of people doing things with support from nurses, but of employers, teachers and others doing really remarkable things. I think of a community in Dartmouth in South Cornwall, Dartmouth in southwest England, who've really come together in response to COVID, who have set up food banks and making sure everyone gets fed, are looking after old people within the community, are providing stuff for children and helping support education and so on. I see remarkable things happening at the moment, which we need to capture and understand that these are really important, just as our health services and healthcare are important, and the prevention of disease is important, so is creating health. Some communities do this by themselves, like the one I just talked about in Dartmouth in southwest England. But health workers have a massive role as facilitators, and nurses, it seems to me, who are part of the local community, have probably the biggest role of all, helping the community to create health, but helping the community to take control for themselves and to organize themselves. So send us your ideas about an innovative nurse-led initiative to empower communities to create and sustain health. And we're really looking forward to hearing from you. And as I said at the beginning, thank you very much to Nursing Now and Nightingale Challenge for the opportunity to have this discussion. And thank you all for thinking about it.
Mm-hmm. Thank you so much, Nigel, as ever, for that inspirational introduction and reminder. The power of the people and the power of nursing and the differences that they can make, and delighted we've got colleagues from Myanmar and Mexico that's with us, and many more I know, but those examples from other countries are really fascinating to hear. So we're now going to move on to Caroline, that's going to talk to us about the social determinants of health, and I know that's something that's again very close to many hearts of nurses working in all sorts of different conditions. Thanks, Caroline.
Great, everybody can see me now? I think so. So I'm going to talk about the environments that we live in, mostly urban environments, and the opportunities that they present for healthcare workers, including nurses, to to address health issues. It might seem that the part of my talk is a little bit negative because I'm going to talk a lot about the different problems that we face. But for every problem, I just like to reiterate that there is opportunities there for creating health. And Giselle is going to later on give some examples of how we can do that. So, you know, the demographic reality that we're talking about right now is that most people are going to be living in urban environments. Urban environments create a lot of opportunities for culture, education, and innovation, but they also have some challenges. Mostly the number of people that we have living in urban slums and informal settlements that don't receive basic services are often even contemplated within the structures of local governments. And then health inequalities tend to be really exacerbated by urban environments. So within that context, the demographic shift that we're seeing that's quite dramatic, the way that we think about health, if we take the definition of the WHO of what health really is, how can we create health at all these different levels? And we'll see that a tremendous amount of our health, 23%, so you know, practically a quarter, is created by the environment that we live in. And these are the urban factors that surround us, the environmental exposures that we have. And that is an incredible opportunity for us to think about how we can create health in these different aspects of the environment. Unfortunately, as I was saying, cities often aren't doing a great job right now on protecting us from the environmental threats that we may face in urban environments, but I think there's more awareness now and willingness every day from a multi-sectoral standpoint, to start addressing them. This is just to show you that, you know, in the global burden of disease study that gives us a picture of where illness and death is coming from. We can see that a lot of these top factors, you know, we can see quite clearly how they might relate to not only personal lifestyle choices, but the environments that we live in. And what I mean by that is there's a lot of emphasis, I think, in the healthcare system to encourage people to make the right decisions, to lead healthy lifestyles. But if the environments that they live in don't help facilitate that or pose barriers to that, then it really is a bit of an unfair ask. So again, thinking about what are the ways from the environmental perspective that we as public health professionals, as practitioners, can intervene and help create health. So these are just some examples. And I think, you know, when we look at these pictures, we can start to imagine a whole host of health factors that might be related to these conditions. So this is my main point number one, that a lot of the drivers of health when we're talking about health creation come from outside the health sector. So how can you as nurses connect with your community, to connect with these other people who are planning the transport systems, the design of the city, and the services within the city, how you connect with them to advocate for what people need to have healthy environments that allow them to make healthy choices in the most efficient and effective way. We at IS Global focus on these 5 environmental exposures. That's not to say that there aren't more, and Giselle will go into them a little bit further, but we focus on these because especially in certain contexts, we see that this is where a large burden of disease and death related to the urban environment is coming from. This is just a quick summary. This is available on our website in a more interactive form that tries to show you the evidence related to these exposures and the systems in our body that are affected. And the main conclusion I think that we can have here is that there really is no stage of life, nor age, nor demographic that is not affected by these exposures, especially things like air pollution, noise pollution, heat, which says health, but it should say heat, physical activity and green space. These are things that affect us across the lifespan. A lot of the consequences of health that we see in cities are related to the mobility patterns that we have. You know, those pictures of congested traffic, people moving everywhere, and motorized traffic they generate a lot of dysfunction in our environment that then generate air pollution, heat effects, and noise, all which are detrimental to our health. And what they do not do is give us a lot of space for green and blue spaces and physical activity. And a lot of cities, up to 60-80% of the public space is dedicated to roadway infrastructure. And that is a bit of a dysfunction because cars are not a way, first of all, that everybody moves, and we need that space to get people to be moving in a more active and sustainable way by biking, walking, to reduce traffic accidents, and to reduce air pollution, noise pollution, and heat, and to be increasing green space and blue space within cities. So we need that space back, and we need to really rethink the mobility piece of this equation. Just very briefly, in many cities across the world, certainly not all, but motor vehicles are the main the main source of air pollution that we're going to find, both particulate matter and gases. Worldwide, the burden of air pollution is truly staggering, and I think qualifies it as definitely a pandemic. This slide I like to show because it's a study that we did here in Barcelona about schools, and shows that the cognitive functionality of children is affected by the air pollution levels that they have in their schools. So this is worrying because these are short-term effects, like we were able to see a difference within just 1 year, but it also speaks to the issue of inequalities, which I think is so important in cities. And those of you who are nurses probably see on a daily basis. So, you know, in this system where children don't really choose where they go to school, we are creating inequalities in their ability to learn and work based on the geographical location of their school and the amount of air pollution, which is usually related to roadways that are around their school. And I think that this is a good point of reflection, because to me, really, it's unacceptable and needs addressing in an urgent way. Noise is also a very underestimated and underconsidered problem for health. A study that we did in Barcelona showed that it was the largest cause of illness, not death, but illness, because when people can't sleep, when they can't rest, even when they're not hearing the noise themselves, the vibrations are still activating our nervous system and hormonal systems and producing alterations. And a lot of people are exposed to unhealthy levels of noise both day and night in cities. And so this is kind of the quantifiable health effects in terms of hospital-related outcomes. Physical activity is another huge issue, and we're starting to move away from the concept of physical activity as something that you do for 20 or 30 minutes each day of the week, as to how within a day, within 24 hours, can we get people to move more and sit less. And so that doesn't necessarily have to mean going to the gym or doing high intensity activities. It can mean gardening, it can mean walking to school, it can mean walking to the store, or replacing trips that you would do every day in motorized transport with active mobility. And I think the key here, again, is to look at how can we include more activity in people's daily lives without having it to be something extra. And so the mobility piece, you know, why aren't all children, for instance, or most children going to and from school in sustainable and active transport, walking, cycling, scooters, like that? Or, you know, adults, what are the ways that we can get people to go to and from work, which are places that they already have to go, usually in active transport, to increase the physical activity that we're doing. I like to show this graph because it shows how something like mobility can be related to health. And it just shows over the course of 100 years, the difference is in an 8-year-old child and their ability to move around. And we see that when car-based transport was not the main method that people got around, that an 8-year-old boy had a 6-mile radius where he could go and explore and learn and be in contact with nature and other people and have a range of experiences that were so critical to his development and growth. And now we come to even, you know, not even today, but about 10 years ago when this was done, and see that basically kids can either go to their front door or at the most the end of their block. And what are the real implications on that for the health of young people? Natural spaces are another one. Again, we need to increase the amount of blue and green spaces in most of our cities so that people have equitable and easy access to a variety of green spaces. There's a number of different health benefits. This is a body of literature that continues to grow. And we're seeing more and more the multiple benefits for specific diseases, but also mental health, aging, happiness, and that these effects are both short and long term. Like children who are more exposed to green space earlier in life are more resilient as adults against mental health issues. So this is just trying to consolidate a little bit of some of the effects. Heat island effects. Heat is the natural disaster that kills the most people worldwide every year. And I think that most of the climate data would tell us, and perhaps our own intuition and own experiences, that heat is on the rise. So this is something that is going to be more and more of an issue. And temperatures within cities can be very much more dramatically higher because of the way that cities are built and the large portion of asphalt that then radiates heat at night. So when we aren't getting lower temperatures in the evening and people can't rest and their bodies can't rest, these are going to cause large health problems. This is a study that we did in Barcelona to try and quantify these aspects, and we see that almost 3,000 cases of premature mortality could be avoided every year in the city of Barcelona if we were able to meet the requirements for the WHO in these 5 factors. And that is not a significant amount. And this is every year, so over a decade, that's almost 30,000 deaths that we could prevent. So with that, the inspiration of there's a lot of opportunities here to work on how we can think about our environments in a more holistic way to be health creating. This is an example of how an urban model like the superblocks in Barcelona, which tries to pacify traffic and open up the public space for other uses, the effect it could have if we were able to implement this new urban model in the city of Barcelona. And again, the exact number is not the most important, but it shows, I think, without a doubt, that the urban model is in fact a public health intervention, and we really need to be looking at them in that way. This is an example of Freiburg, Germany, that puts into an image a lot of the things that we're talking about. There are no cars in this area. People move around in active and sustainable transport. You can imagine that aspects like social cohesion, nutrition, social activities, culture activities, and a whole host of other benefits that an environment like this will provide to its residents. So it is possible. So this is, my second and main message, kind of my concluding message is that nurses can connect with people in their communities and the people who plan and make decisions about how our communities are to help protect and promote health, to create health. Nursing is a vocation. And in that sense, the job never ends. Nigel gave us a number of examples of nurses that went beyond facility-based activities to create health in their community, and certainly in their urban context, there is any number of opportunities. So don't stop advocating, don't stop talking to people, and don't stop looking around for the ways that you can do this. This is just, to say, how do we do this? I think the SDGs give us a good roadmap, and we try to link all the ways, not just with SDG 3, but all of the SDGs where urban health comes into play and the different indicators that we can have. And we can really see that this is a transversal element that then requires really a multi-sectoral approach. So as nurses, you are respected members of your community. You have access to a large number of people as patients and in other ways. And so how can you be connecting with these other sectors to bring these perspectives and bring these ideas and bring these solutions to different people? And I think that nurses are particularly well poised to engage with communities, engage with citizens. Citizen science, for instance, in the research world is on the rise. Unfortunately, we are more and more working with citizens to collect their own data, to design studies where they are empowered to investigate, understand, and then make decisions about their environments. And I think nurses can certainly have a role to play there. Thank you very much. Feel free to consult our web or contact me afterwards with any specific questions. I'm really delighted to be here.
Thanks so very much, Caroline. That was brilliant, and we've got many more people joining us from all sorts of different places all over the world, from Ghana to Croatia and beyond. So it's great for people to be hearing all about this work, and it reminds me of some work that we did a little while ago now. This was mainly in England, about making every contact count, and it was trying to encourage nurses and actually all clinicians to think about making the contact count around the public health and prevention agenda. And I think you're absolutely right that nurses do connect naturally with communities. A nurse knocks a door and often the door gets opened without a question. So the power that nurses have to influence this agenda is huge. And just to remind the people that are listening in, feel free to put questions into the chat box. There will be an opportunity to ask the panel questions as you start to think about what your solution might be following these brilliant set of presentations. So we're going to move now to Giselle, that's going to talk to us more about some of the examples of the programs that you're leading on in terms of really making a difference in this space. Thanks so much, Giselle. Over to you.
Perfect. And can I just confirm that you can see my screen all right?
Yep, it looks great.
Perfect. Well, thank you so much, Lisa. And also thank you to Carolyn. That was an absolutely fantastic overview of the multitude of ways that our social and physical environments make an impact on our health and well-being. And I just want to thank everyone. It is truly a pleasure to be here with this remarkable panel and with all of you nurses that have joined us to talk about how we can bring health into even more aspects of our lives, from work to home to our public spaces and to our communities. And just by way of brief introduction, I'm Giselle Sabag, an architect, urban planner, public health professional, working to improve urban health by design. And I am working as a pro bono advisor and consultant to mayors and civil servants around the world looking to build health into their cities at Bloomberg Associates. So today I wanted to briefly show some of the examples of ways that, as Carolyn said, professionals and other disciplines impact our health in the community. And so we'll briefly cover the following questions today. I'll just go through what healthy community design means, how it affects health, what some of those principles and benefits are, what that looks like in action, and what you all as nurses can do to create and sustain even more health in your communities. And so what do I mean by healthy community design? I'm talking about an approach to designing workplaces, neighborhoods, communities, and cities in ways that support and encourage positive physical, mental, and social health. So as Carolyn mentioned, the way our communities are designed makes a big impact on our health. But the good news about that is that since every decision is a choice made by our architect, urban planner, transportation designer, policymaker, government agency friends, it means that they actually can choose to design for health and to alter our social and environmental community to improve and support health and well-being for ourselves and all of our families. So, for example, and Carolyn mentioned this too, whether or not your kids can walk or bike safely to school in your neighborhood was a decision that was made by the people who designed your community, city planners, urban designers, developers. And of course, water quality is impacted also by those decisions. And that's water quality for drinking, but also for recreation. Oops. And then some of you might be familiar with the US's sky-high rates of traffic fatalities and accidents, but it really is a problem all over the world. And the thing that I want to, just mention here is that it's truly a choice. It's a choice that can be changed. And in fact, what we might think about is the good example of Amsterdam, which was actually completely transformed into a bicycle-friendly city not all that long ago, only after a prominent journalist child was killed by a car, and really started and demanded a movement for safer streets for kids in the city. And that's the way that it got to the bike-friendly and safe way that it is today. And so similarly, you're all, I'm sure, very familiar with the ways that your patients' access to healthy and affordable foods looks very different depending on what neighborhood or community that they live in. And, unfortunately, we're all suffering, as Carolyn mentioned as well, from the impacts of increased greenhouse gas emissions and the unsustainable development patterns that many cities today have. And that's made a big impact on climate change, which of course affects food supply and increases the risk of vector-borne diseases like dengue or Zika, but it also shares many of its root causes with things that make us vulnerable to zoonotic diseases, that COVID-19 is one example of that. And then social capital has also been shown to have a significant impact on your health and well-being and your life expectancy, and all that also has to do with the community and the design of the place that you live in. And similarly, social equity or inequality is responsible for many of the serious health disparities that we're seeing now, with the virus affecting some neighborhoods and populations disproportionately. So I just wanted to give that very quick overview of some of the principles that should be designed into our communities. Carolyn mentioned many of them, and some of the benefits that we get out of that. But there are also many resources that have been published now that really do lay out ways, practical ways to advance health within your workplaces and public spaces in your community. So I just wanted to show briefly a couple examples from a program that I wrote together with the Centers for the U.S. Centers for Disease Control and Prevention, and was launched in 2016. So this is a program where in a variety of different workplace environments, you can implement these strategies to support and improve health. So one of those examples is the location of your workplace and making sure that public transportation is located within a safe walking distance of the building. And the reason for that is because walking to and from public transportation, even that small amount of walking, can actually help to improve physical activity and can help you attain the recommended level of physical activity in your daily life. Another strategy to improve health in the workplace is to provide an outdoor space amenity that's accessible from a building entrance. So there's a wide variety of ways that this can look. These are all in hospital settings, and many of you might be working in healthcare or hospital settings. And so if there's an opportunity for green space, even within your workplace, that can support health of everyone, including you all who are supporting the patients that you're working with. It can also be good for kids who are there. Because increasing the exposure that you have to nature is a really good way to enhance mental health and well-being and to promote workplace health. Similarly, again, mobility and transit has so much to do with all of this, but if we can locate our main building entrances oriented to pedestrian traffic and to transit and to offer active transportation opportunities, this is a way to boost health right there, getting from work to home. Again, we know now that the more time people spend in their cars, the less good they're going to feel, and that exercise can make you feel better. Stairwells is a similar opportunity for workplace health. Many of you, I'm sure, have stairwells in your workplaces, and some may or may not get used as much as others, but there's an opportunity to actually encourage physical activity even within your work environment that does boost your health and well-being. And you can actually make an impact on the average amount of annual weight gain that we most of us experience in the developed world. Water supply is similarly, it's very obvious. I'm sure many of you have it in developed countries, but in other contexts where potable water is not always freely available, it is one way to actually enhance water intake and hydration. And then also thinking about the food that's offered. Now, this is something that's been a big battle in the US for many, many years, but even in healthcare environments, often the health options are not as nutritious as they should be. And there are opportunities to incorporate that into the design of your buildings and workplaces. So those were just some examples. You can also do price incentives and choice architecture in what's offered at work. And so those are just some examples of even within your workplace, how you can be thinking about health and well-being and the connection that you have to the community. So and I'll go very briefly here, but just to show one other example from a different country context, this is a program called Urban 95 that we did in Bogota in partnership with an organization based in the Netherlands called the Bernard Van Leer Foundation that's focused on early childhood development, and with the city of Bogota under the administration of Mayor Peñalosa. The 95 here is referring to the average height of a 3-year-old child. And the project was working with the community and with children themselves, age 0 to 5, and their caregivers to transform one of the most dangerous neighborhoods in Bogota, where it was too unsafe for kids to play outside at all, or for caregivers to socialize with each other. And kids could not walk to school, they had nowhere to play, to completely transform that into a neighborhood that was dedicated to the improvement of health and well-being for young children. So here's a map of the neighborhood and the interventions that were done. And I'll just very quickly show you a couple of photos. So this is what the neighborhood looked like before. You can see that it was dirty. You needed security to go outside. No, that is actually on the bottom side of your screen. That's a big street with a big pile of trash. Unfortunately, that's actually the access to one of the most important schools in the neighborhood. It was really unsafe, big buses coming up and down the road. So this is kind of some of the look of that. But we worked with the community on an extensive community engagement campaign to map the neighborhood with the caregivers and their young children to understand where the opportunities were and where we might improve the design of the community to enhance the environment for children and their caregivers. And so we put in several interventions, including safe crossings, upgrading the lighting, creating parks dedicated to supporting early childhood development, improving green space access, having play areas that were safe, etc. And so you can see some of these before and afters. We put in some dedicated playgrounds. There's an environmental classroom with an agricultural garden where they can learn about diet and nutrition and also environmental practices and waste disposal, improved road safety, created safe pedestrian areas for play for children. And here are some other playgrounds that were added for safe physical activity and play that just simply did not exist in this type of neighborhood before. There was also a mural painted at the front of the school, designed by and then actually painted by the community themselves. Similarly, a slide and an area for young children to safely play and to support their early childhood development, as well as play with other kids and also caregivers to interact with each other. Safe routes and crossings is always an important theme. This is something that did not exist before, and the car traffic has gone down considerably. And this was the environmental classroom that was built. Also, the neighborhood and the community themselves created these pop-up play kits that were deployed in public spaces on weekends and evenings after school. And so this was a summary of some of the interventions that we did. And there's several benefits, but overall, all of these benefits lead to improved physical, social, and mental health in the community. Some other examples of Paris and Milan, similar ideas. And my point with this was just that if Bogota and a community like this could do it, where even the Bogotanos would never go there, now it's been completely transformed into a destination for families, young children, and their caregivers to play and their health being supported outdoors. Anyone can do it. And so nurses can do so many things. You have a special and unique opportunity, I think, as stewards of health in your community. And so there's just a number of strategies that that you all, might consider implementing in your neighborhoods and communities, starting at work, but also thinking about how you get to and from work, and getting involved in your local community planning board, helping to make the healthy choice the easy choice. And if you have kids, also thinking about working with other parents to ensure that your kids can get to school safely, and even thinking about the community garden opportunities for yourselves, your neighbors, and others, and to get everyone involved. So with that, I'll turn it over to Mark. And I was, if there's time afterwards for a discussion, I was thinking that it would be nice for us all to consider what it is that we can commit to do in our communities to promote and sustain health today. Thank you so much.
Brilliant, brilliant, Giselle. Gosh, that's really transformational, isn't it? It's amazing, and I'm sure the audience are thinking, how can they get more involved in making some of these fantastic changes? And one of the questions that's buzzing around is, how do you get involved in the architecture and the design of communities? And I guess this engaging with the local community planning boards and finding out who sits on those and where they are and where they meet, maybe one of the ways forward with that. But brilliant, super visuals and real impactful examples. So thank you so very much for that. We now hand over to Mark. So hi, Mark. Mark's going to talk to us about the Healthy City Design Congress and the opportunity for the winner of the Nightingale Challenge Global Solution for this one to spend time in that space with him. So Mark, over to you.
Thank you very much, Lisa, and thank you to Nigel, Giselle, Carolyn, and again, it's just a pleasure. It was a few weeks ago to have the opportunity to speak to such a wonderful community, such an important community of nurses all over the world on this topic, and we feel very privileged to have the opportunity really to invite you to all to submit your ideas, your solutions to respond to the challenge, to develop an innovative nurse-led initiative to empower communities to create and sustain health. We're very much hoping that we can provide a platform for nurses to present those ideas, and really, as to reiterate a little bit of what Carolyn and Giselle spoke about, to really explore how to engage and how to collaborate with different professions, from public health to designers, architects, planners, businesses, employers, entrepreneurs, in how we activate these places and environments, our cities and our communities, to support health creation. And as Nigel's often talked about, the concept of human flourishing, really. The theme of our Congress, Healthy City Design, which has been, the event has been around for 4 years now. It's really been bringing together a truly interdisciplinary community over that period to really think about how the environment supports our health, and how the way we design it, as Giselle mentioned, we can make those decisions that really provide the context not just for our physical and mental health, but for the choices we make as individuals to be healthy in our daily lives. I hope today has given everyone a bit of an insight, perhaps, into how that potential is there to collaborate with all types of other professions from different communities. And that's very much what Healthy City Design is about. It's about bringing together people who may not otherwise get the opportunity to meet, to really come together and explore how to be creative. Because I think once you bring different disciplines together across different sectors and from different perspectives and different experiences, then that's where the real creative solutions come from. So this year's theme for Healthy City Design which was launched just at the very beginning of the pandemic outbreak, particularly in Europe, is called Designing Resilient Communities: Recovery, Renewal and Renaissance. And I think, in this pandemic, when, the world is highly stressed, we need to look at where the hope is and where that renaissance is. And much of that is going to come from that creative, interdisciplinary working together. As Carolyn mentioned, we're living in an increasingly urbanized world that is really struggling to adapt not just to a pandemic and a public health emergency, but the bigger picture of a climate crisis and a planetary health crisis. And ultimately, we can't have a healthy society on a sick planet. And these are two great fundamentals that we have to address as a society. The ability of our densely populated cities now, municipal authorities and governments, to really keep all our citizens safe and well has never been under greater scrutiny. But we can't leave it just to the governments and the authorities. We need to take that responsibility as professions, as society, to work together collectively to address these issues. And we've for a long time been arguing that public health professionals, scientists, urban planners, architects, policymakers must now speak with one voice on the need to make our cities and communities more resilient in the face of these far-reaching and life-changing threats. But we missed probably one of the most important, largest and maybe most trusted groups in society anywhere in the world, and that's the nursing community, who really do have a powerful role to play. And I think, what's been great, we did have a conversation before, but I think Giselle and Carolyn and all of us are really coming to you with that idea, that actually, you can make the difference here. So resilience, it's taken on a whole new dimension during the pandemic, and it's a real tribute, as Nigel said, to nurses at the front line of this crisis, that there's no more resilient a group than nurses. And we understanding what resilience means in its narrowest sense, resilience means snapping back into shape after an adverse incident or effect. And we're seeing that every day in our lives at the moment. And it's tough. It's really hard for so many people, and particularly for nurses at the front line of this crisis. But at the same time, we have to anticipate that future and have the capacity to adapt, not only to be disease resistant, but to be health creating in the culture and design of our environments and cities and communities. And again, nurses can play a really powerful role in helping to embed this. And at the very heart of that, is social and community resilience. And the Congress will talk a lot about how design strategies in the built environment can create more social connection among people of all ages, of all abilities, improving air quality, which Caroline talked so clearly about, the challenge there, decreasing social isolation, reducing inequalities, delivering green spaces and providing safe, affordable and health promoting housing to boost community well-being. These are the real roots in which health can be created. connected to this, we'll also talk about the issue of food resilience, which Giselle also touched on. And as life expectancy stalls amongst the poorest, how can communities maintain supply to fresh, locally produced food that will fuel citizens, avoid panic buying in times of distress like now, and prevent ill health? And here too, nurses can help to activate communities to be health creating and work with the planners and the architects and all the many different professions that make up a city or a community. So again, we're really excited to be a part of this, to have the opportunity to allow to engage and invite the winners of the challenge to submit their ideas and provide a platform to present those ideas, and hoping that it will stimulate a new dialogue across professions, and something that we can take on into the future in the way that we work with everyone. So, you know, just summarize, how can you as nurses help to co-design the communities and the environments we live in? It can be a choice that we make for future generations, if not current generations, to live and create healthier homes, healthier workplaces, healthier schools, healthier parks, you know, and really not just build and design them, but then activate them. Because it's one thing designing and building, but then people are needed to activate those spaces and make them work. So thank you very much, everyone. And we're really looking forward to hearing all about your ideas and solutions. Back to you, Lisa.
Thanks, Mark. That's superb, really superb. And I just love that term, activating communities. And I think nurses will really be able to speak to ways in which they contribute to activating communities. You're in for a treat, I think, Mark and colleagues, because just today we met the Nightingale Challenge Global Solution 1 winners, and they were student nurses from Ghana that have got a really exciting, innovative approach to how they can give better care that's more seamless using digital technology to patients in Ghana that have had brain injury. So there's some amazing, it was really difficult to pick a winner, so be prepared to have a difficult task going forward with this, because there are some amazing ideas out there from the nursing community. So we've now got a couple of questions that have popped into the box and into the chat space. And the first one, Nigel, starts with you, and the question is about where did you get your inspiration from to write the latest book, and on top of all the other things that you do, to really think about this huge agenda and the role that you can play in making the changes that are needed.
Well, I suppose there are two answers to that. They're both right. The first one, which is the longer term sort of slow burn, really, is that after I'd worked in the NHS, so one of the most sophisticated health systems in the world, I then went and spent a lot of time working in Africa and Southeast Asia. And of course, very different circumstances. People see the world differently. And there was much, much more focus on health. We tend to focus on the problems in our healthcare system, as I said earlier, in doing the repairs, you know, sorting out people when they're ill. Whereas actually in other communities, there's often more focus on health. Although, let's be clear, there's a great need for health services. Nothing I'm saying doesn't imply you need hospitals and health professionals or everywhere, but there's a bit more focus on health. And there's also a focus on the role of communities and the role of women, particularly, actually. In communities, and I think of places like Bangladesh and elsewhere where this is particularly true. So that's the sort of slow burn, you know, that has been making me think for some time. But more recently in England, I've come across just a lot of people who are doing interesting stuff that is fun with communities and developing new ideas. And it seemed to me there was a pattern there, and it's not a new pattern. In a way, because you know there's always been voluntary and community activity, but there's great history here. There's history of salutagenesis, as it's called in sort of scientific terms, and goes back to the Greeks, to Plato and Aristotle, who had a term called eudaimonia, which is often translated as human flourishing. You know, and how do you help people to flourish? So I got interested in these ideas, But the short answer is people, Lisa. People, and seeing what people are doing. That's how you learn often, rather than what you necessarily read in books, important as that is, but people.
Brilliant. Thanks so much. So don't overthink it by the sound of it, Nigel. Follow your passion and engage, listen deeply and learn what's out there and see how you can get involved, which actually leads to the next question, which I think is for Carolyn and Giselle, and that's around nurses might not speak very often or frequently to, people that are architects or people that are focused on planning cities and design. What's the sort of language, what top tips would you give to early career nurses that are really, competent at talking to doctors, to other clinicians, but when it comes to talking to maybe an architect, they're not going to know that language maybe, or they're certainly wanting to connect on a different level than health. What would you recommend that they start with in terms of, I guess, the elevator pitch as to why they should be there and how they can contribute on an equal footing to the architects, the designers, and all of those eminent folk that do this really exciting work?
I would say being passionate is important, right? When people can tell that you believe in what you're saying and what you're doing, that's always helpful. And I think being a respected professional, which nurses are, so you already have that on your side, you have credibility. I think sometimes being able to come with a little bit of data is very helpful.
Right.
If you want to talk about school kids or road safety, if you have some basic data about traffic accidents, even if it's only local. If not, you can go to the WHO or their websites, like the data that I give you about air pollution. Having one or two key facts often will make other people ears perk up. A few facts can be very useful to support what you're saying. But then I think, you can look for informal ways as well. To reach out to people. I mean, the planning commission would be certainly one way, but you can go and try and see who in your community has access to the politicians and the decision makers too. For instance, a school principal, they will have regular meetings with the school board. The school board talks to the mayor, so it's looking at the chain of different people involved, and you don't necessarily have to go right to the architect, but maybe one of your patients or maybe someone you work with is a brother or sister of an architect, or I think nurses have that advantage that you come into contact with a lot of different people throughout today. So it's starting to make the connections really at any level, and then little by little you'll get to where you need to be. It depends a lot on the different structure of a city. Does the city have a chief architect? Or is it a political person? You have to do a little bit of diagnosis and thinking, but if you know your community, if you can do a little map of who are the key actors and how you might have access to them, I think that can be helpful as well. And yeah, I mean, we don't necessarily have a shared language, and that's part of the process. I mean, it takes time, to develop the shared language, to understand what we're all talking about. So it requires some patience to do that. But I think health, fortunately, is a universal concept, and everybody knows what it means to be in poor health, and people want to be in good health. So it often can be a door opener. And we often hear from political decision makers that they wish that people from the community or people with other capacities would come to them. I remember being at a forum with a city manager, and he said, "I have 15 universities within a 5-mile radius of my office, and never has any one of them come to talk to me about what I can do to make the city healthier." So, you can feel free as a nurse, you are you are a credible source to understand about what's going on with the health of your patients in your community, and leverage that to say, I'm a nurse in this community, I'm concerned about XYZ, I would like to come in and talk to you about what solutions we can have. I also think pointing out the problem like I did is very important, but always being ready to have some solutions like Giselle did is fundamental. We have a lot of problems out there, they can be overwhelming. So it's good to be able to put out the scene, to put it out there what we have, but then also always be thinking about what we can do to address it. Giselle, you probably have some things to add.
Just to add briefly to everything that Carolyn said, I think that, architects and planners, unfortunately, we're simply, and policymakers, we're just not taught about the ways that our decisions actually impact health. And I think there's a really renewed interest. I mean, public health in particular and urban planning were really developed together, but then they sort of went away from each other. And I think what we've seen over the last, I don't know, 15, 20 years or so is a real interest in getting to know, the ways that our planning decisions, our environmental decisions do impact health. But you can sort of assume that most people in your community who are making these decisions, they might not know. And I think you as nurses can really take that opportunity to educate and inform your fellow, citizens about the ways that health is impacted by the decisions that they're making. I would say that's one thing. I also think you have really powerful, and Carolyn sort of touched on this, but I think you have really, really powerful stories that you can tell about your patients. You can see every day from the work that you're doing, the ways that the neighborhood and the community could actually be enhanced to support better health and well-being. So I think telling those stories about people that that, let's say, have experienced, there might be a road safety issue in your neighborhood that you've seen. There might be even a gun violence issue that you've seen, or an obesity or a diabetes issue impacted by diet and nutrition in your community, or inadequate opportunities for physical activity. You can sort of tell those stories on a human level, and I think that really helps to get your point across. And as we've all been reiterating, you really are trusted health voices in the community. Yes, you can also. Planning boards are one thing, but there's always public meetings going on. It's actually a requirement for most city governments to hold public meetings with the community and to get their input. So of course you're busy, you're working, you might not have time to do that, but you could still look for opportunities to get engaged and to tell your policymakers directly what it is, they want to hear from you, how it is that health can make an impact. And I think all the public spaces that you interact with in your everyday life, whether it's, the way you get to work, the way your kids get to school, if it's safe, if it's unsafe, if there are sidewalks that feel good or that even exist, or if you feel like you're going to get hit by a car all the time, or if there are parks, green spaces, recreation amenities that your city is offering to you, tell the agencies that are leading that, your transportation department, your parks and recreation department, tell them the way you want those areas to change for you and your community to support health and well-being. So I think all the things that Carolyn said, but you are members of your community. And I think we can just assume that people aren't purposely making the wrong decisions, but maybe they just don't know about the ways that health can be impacted. And you can help them to learn that and to incorporate that into the work that they do as well.
Brilliant. Thank you both so much. And I guess amongst all of that, the kind of golden thread was that the nurses need to be confident about themselves and what they bring to the table as a nurse, as a clinician. The things that they do naturally will be of benefit to people that are designing these buildings and thinking about how you can create healthy cities. So I think they mustn't underestimate that. And thank you for all of those tips. And we can provide more information to people as well as they start to think about their ideas. So that's brilliant advice. And then I think the last question is probably, Mark, for you, and that's a question around digital enablement, and in terms of sort of the digital capacity that we've got now in some countries. How do you see that playing into healthy communities moving forward? Will it make us more healthier or less healthier? I'm thinking about apps, and people can have all sorts of things connected to themselves to encourage them to walk a little bit more or get involved a bit more in going outside. Is this proving to be successful in places, or perhaps a red herring in the big scheme of things?
Well, it's a very interesting question, I think, and I think technology is becoming ubiquitous in all of our lives, and it's probably accelerated, of course, over the last few months. And I think the threat of the challenge of technology is that it can either have a utopian or a dystopian impact, and I think we have to be very careful about how we apply it and how we use it, but without question it has a huge potential to really join up. I was having a conversation just this morning actually with a physiotherapist who is involved in tech consultancy, so a lot to do with apps and how to encourage people to exercise and behave and really try and promote behavior change through data and personal things. And we were talking about really how the potential of it is also to really join up the health system to communities as well. And it's almost like the missing piece, perhaps, because where a bit like Giselle said, that public health and urban planning kind of moved away from each other, public health and healthcare kind of moved away from each other as well. And we're trying to rejoin them up, and COVID has really exposed that big gap in the middle. And nurses, I think, have a very powerful role to play, to fill that gap in the middle, because often if you go to your GP, it's still very medicalized, when actually you wonder, should the GP be saying to us, well, actually, I think we need to look at your diet, your living conditions, your lifestyle. Perhaps I can suggest that you go and see a nutritionist, or actually, I think nurses could play a really important role in that, because actually, in some ways, they're more trusted, to have those kind of conversations. As Giselle said, they can tell the stories. And I think technology also plays a role in that bit in the middle, to try and join everything up. But I think we also have to remember that it's technology is an enabler, it's a facilitator, not an end in itself. So that would be my thoughts on that.
Brilliant, Mark. And I think, the sort of enabler of technology to help build communities of practice and to help connect people with each other that have got like-minded challenges is something that nurses do brilliantly in lots of different places all over the world. And, we've got Facebook, we've got WhatsApp, we've got lots of different platforms now that we can connect people to each other so that you can create those communities. So I think that can't be underestimated, because the power of the lived experience and helping people to connect with like-minded people is really helpful when you're trying to shift that behaviour change and create that new culture and set of practices that you want people to start to think about, to shift them into more of a healthier space. So thank you so very much for that. It's a good reminder to our participants to not underestimate the brilliant work that they're probably already doing and how that can be used for this challenge. Well, I think we've now come to the end of our questions, and therefore we're ready to wrap up. Is there anything that any of the panel members would like to say as a final comment? I want to say just thank you so much for your time, your energy. I'm on such a learning journey here, because this isn't something I know loads about. So thank you very much. And I think, Nigel, you'd probably want to say a word or two.
Great. Well, thank you very much indeed, Lisa. Yeah, fascinating, isn't it? Two very big points. One is, when you look at what professions are trusted most globally, nurses come at the top now, actually above doctors. So, health professionals are very high, but nurses are right at the top. Another important point that kept coming up is that actually planning and health, public health, grew up together in the UK very strongly. And indeed, our ministers of health were also ministers of planning until 30 years ago. So there was a real connection that we've lost, and we need to recover. I thought both Carolyn and Giselle gave us fantastic presentations with some real practical dimensions to them. There is things that can be done. This isn't just for talking about, as it were. So really, really grateful for that. And as both of them made the point as well, the evidence is increasing, as to what works and what doesn't work. And there are people out there working on all of this. So we're seeing a movement of change here in terms of all of this happening. Turning to nurses, there are different sorts of roles that people can play, as have been talked about and indeed listed out by colleagues. I just want to make a couple of points on that. Actually, you don't have to do a big thing. You can do a small thing, and small things can have big impacts. And actually, there is a great saying, which is start small, think big, and go fast. So you don't have to redesign your entire city. Just start with a little bit in front of you, with the problem you see in front of you and the passion that the people talked about, whether it's about food or road safety or kids who need some support and help and organising activities or whatever. And we'd love to hear from you, whether it's small ideas, big ideas, whether it's things you're doing, or whether things you're still just thinking about doing. But the second point is do it. You know, this is all based on passion, as people have said. And then the final point on nurses as well. There is a bit that it's interesting how it's come out, the question of confidence. I know in nursing circles people talk about the importance of leadership an awful lot. The danger is nurses and leadership sometimes make it sound as if it's leadership of nurses and leadership of nursing policy and stuff. Actually, you as nurses should be engaged in leadership discussions about all different areas of life, including this one. And that's really important. And you do have a massive amount to contribute because of your closeness to the community and your engagement in people's day-to-day life. And that's a really important role to play. So we're looking forward to hearing from you. We're fascinating, as I say, to hear how this whole field is moving on with leading practitioners, Mark and Carolyn and Giselle to talk to us about it. So thank you all for your contributions. Thank you, Lisa. Thank you, Nursing Now. Thank you, Nightingale Challenge. Thank you, Salis. And then thank you, everybody, for joining us. Thank you.
Perfect. Bye-bye.
Goodbye.
Bye.